Video fluoroscopy swallowing study. Video fluoroscopy swallowing study. Modified barium swallow. Radiographic diagnostic procedure to detect any oral, pharyngeal, or upper esophageal dysfunction by direct and dynamic view. Video fluoroscopy swallowing lateral and posterior anterior view. Post-stroke dysphagia showing aspiration. Gold standard for assessment of dysphagia. Video fluoroscopy swallowing study recommended after clinical swallowing study except for patients with high risk of aspiration, performed by team consisting of physiatrist, radiologist, and speech language pathologist. Indication to detect any abnormality in the anatomy and physiology, to assess airway protection before, during, and after swallowing, to assess improvement of swallowing in various posture, maneuver, dietary modification, and sensory enhancement. To detect appropriate therapeutic modality for oral, pharyngeal, and laryngeal disorder. To detect appropriate therapeutic modality for oral, pharyngeal, or laryngeal disorder. To frame rehab protocol for patient with dysphagia. To collaborate with team member and to educate patient and caregiver. Medically unstable, unconscious, medically unsound, and uncooperative. End of life situation, pregnancy. Contraindications are medically unstable and unconscious, medically unsound and cooperative patient, end of life situation, pregnancy, unable to be positioned properly, allergy to the barium. Limitation: radiation exposure. Barium alters viscosity and composition of food. Unable to assess fatigue effect on swallowing. Sitting position of patient for normal swallowing. Prepare barium mixed liquid or food, different consistency. Administer small amount of liquid or food from thin liquid to solid food. Fluoroscopic video recording during oral, pharyngeal, and esophageal phase. Evaluate lateral and anterior posterior view. Lateral view में oral pharyngeal transit time delay and physiological problem. Anterior posterior view में asymmetry of residue in vallicula and pyriform sinus. Visualize pharyngeal contraction. Based on video fluoroscopy swallowing study, functional dysphagia scale to find out subglottic aspiration, penetration aspiration scale to quantify airway entry of bolus, modified videoscopic dysphagia scale to predict persistent dysphagia of post-stroke patient, modified barium swallow impairment profile, fiber optic evaluation of swallowing. Flexible endoscope is introduced through nostril, followed by laryngopharyngeal sensory test. Both static and dynamic pharyngeal anatomy and oropharyngeal